accusing Donald Trump of stoking politically.
Good afternoon, everybody. We're just going to give you an update on the program of ongoing improvements that we're implementing at managed isolation and quarantine facilities. Firstly, in regards to the testing of staff. Between the 21st and 27th of August, 97% of the total managed isolation and quarantine workforce were tested for COVID-19. No staff tested positive for COVID from that testing. The 3% of staff who were not tested were on leave or didn't enter a facility during the period under question. This shows the robust infection and prevention and control measures, including PPE, physical distancing and cleaning and hygiene within facilities, and daily health checks for all MIQ staff are working. On the 21st of August, Air Commodore Webb directed that all staff continued to be tested. The next round of testing of MIQ workers is currently underway as per the health order issued by the Director General and is due to be completed by Sunday the 6th of September. In regards to returnee testing, the figures we have are from the 18th of July to the 24th of August. These are the completed tests recorded by the Ministry of Health. They show that 97% of day 12 tests in MIQs were completed. The data shows that 95% of day 3 tests were completed. In that time, 11,647 day 3 tests were completed out of 12,240 returnees. Reasons why the day 3 tests might not have been done can range over a number of reasons. They could be that it was a child under 6 months, that they were medically exempt from taking the test, that they were a maritime or other transit passenger of between 24 and 72 hours and weren't in an MIQ for long enough to be there for a day 3 tests, or it could have been they were people that refused a test. Contrary to some recent reporting, this shows that very high levels of day 3 testing and compliance with the regime, noting that day 3 tests are not compulsory but are being done in high numbers nonetheless. We know day 3 tests are only part of the management of people in managed isolation facilities, and with or without the test, returnees are still managed in a way that considers that they may have COVID-19. No one leaves a managed isolation facility without a critical day 12 test unless approved by the Director General of Health as having a medical reason not to. Those people who refuse day 12 tests get the pleasure of staying at a managed isolation facility for a little while longer, and most of the time they eventually take the test before they reach day 28, which under the order they can be asked to stay with us for. I think last week we shared the data with you that to date there had been 15 people who had initially elected not to take a day 12 test. All of those people either decided that once informed that they were going to be staying with us a little bit longer to take the test, or eventually at some time in the lead up to the 28-day period did take the test. So I'll let Air Commodore Webb talk to you about the increased security arrangements that are currently being ramped up at the facilities. In terms of the COVID card trial that we'll be doing in the managed isolation and quarantine facilities, and this is work that is currently being scoped up and will apply to both returnees and staff. Thank you.
Thank you, Minister. Good afternoon, everybody. To date, over 44,000 people have successfully been through managed isolation and quarantine and have come safely into our community. Our effective capacity across 32 facilities is 6,628, and there are currently 5,035 people in managed isolation or quarantine. By the end of this week, we expect to have 5,638 people in isolation. We are continuing the rollout of the extra 500 New Zealand Defence Force personnel to our MIQ facilities. 108 are currently at their posts and 75 will be rolled out each week for the next 5 weeks. There will be an average of 19 NZDF personnel at each facility, and this will be the largest use of NZDF personnel since our operations in East Timor. NZDF personnel have been given limited powers by the Director General of Health to give legal directions to people at our facilities and to approve or deny entry. People are legally required to comply with those directions. However, enforcement of those directions will, of course, be managed by the New Zealand Police. All of these personnel receive pre-deployment training that covers things such as supporting and acting with empathy, compassion in difficult circumstances, appropriate conduct and legal powers, the use of PPE, training in standard operating procedures, and COVID-specific health information to identify symptoms and, of course, take care of their own health and well-being. We have started the transition away from private security guards to guards employed directly by MB and are rolling out additional security technology. Lastly, I'd like to talk just briefly about exemptions. Exemptions, just again as a reminder, are granted in very limited circumstances. Our job is to keep COVID out of our communities, and we can't allow any undue health risk. Every single exemption request is assessed by a cross-functional team and looking at a case-by-case basis. The final decision is made either by me or by my colleague, Deputy Chief Executive for MIQ, Megan Main. Most exemptions are granted for people to join unaccompanied minors, people who are in transit, or people whose medical needs require hospital-level care. Exemptions can be issued for exceptional circumstances, for example, to visit a dying relative, and then only when the health risk is very low and we are assured it can be managed. When they are granted an exceptional release, in this instance, infection prevention and control measures and a self-isolation plan are still in place. Many of these exemptions will involve a day visit and then subsequently returning to managed isolation. Thank you, Minister.
Thank you. Happy to take any questions.
Quite a high number of cases that have been picked up in MIQs today. Is that because of ramped up testing?
No. Of course, our testing at MIQs has been consistent throughout, that everybody is tested, that the cases that we're seeing really is an indication of the fact that COVID is growing, not slowing around the world, and that we've had a couple of flights come in from places where we're seeing very high rates of growth of COVID, and this is to be expected when you're setting up managed isolation and quarantine facilities at the border. They're doing exactly the job that they were designed to do, and that is ensuring that people that enter New Zealand are tested and isolated for 14 days so that we can find out if they do have COVID and, if necessary, quarantine them.
The positive cases connected to that Air India flight. What can you tell us about the crew on board that flight? Have they entered New Zealand and are they being isolated?
Yeah, Air India flights routinely come through different places, including New Zealand, and their crew members are required to comply with Ministry of Health guidelines. Information we have, of course, that's not specific to MIQ, so it doesn't fall under our mandate, but what we do know is they do comply with the health guidelines. They have needs such as requiring to wear PPE, to self-isolate, to maintain physical separation requirements. So that's just an airline compliance requirement with health guidelines.
It's popped up in MIQ today in Wellington. Is that the first instance of one in Wellington? And how did that person get here, and what sort of contact tracing needs to be done, and how do you get them to a quarantine facility?
So the case in Wellington, I'll just start off. I understand that is a returnee from the United States, the Wellington case. I think it is the first case in a managed isolation facility in Wellington that we've had here. In terms of the contact tracing, that everybody is treated within a managed isolation facility as if they could have COVID. So in terms of the physical distancing, the PPE, all those kind of things. If there is a breach of that at the facility, that is picked up earlier. So nobody, by definition, within a managed isolation facility has a close contact other than the people that they're in a bubble with.
Because that obviously, so the United States flight would have come into Auckland, so how would that person have got to managed isolation in Wellington? What sort of contact tracing is that going to involve? And presumably you need to now get them back to Auckland to quarantine, right?
Yeah, so this was NZ1 flight from LAX, a routine flight. Many of you probably have caught that flight over the years. We have an internal domestic transfer system to manage the flow of New Zealanders right across the country, as I'm sure you'll be aware. So this individual would have been on one of those transit flights from Auckland to Wellington under the rules we have in place. Wellington has a dual facility, which is both an isolation and a quarantine facility. So they have a specific segregated area for people under quarantine conditions, which are a tighter regime than isolation, with additional hospital care and daily needs. Once the needs of that person has been met, they will then be taken to their final destination, whether that's Wellington or Auckland or anywhere else in New Zealand.
Is the facility the same in Christchurch as well? Because I
That's
thought
right.
that Jet Park was the only
Yes, so
quarantine.
Jet Park is, when you look at Auckland, you have 18 facilities. So as a ratio of volume and mass, we have a specific standalone quarantine facility in Auckland. When we're looking to try and use our locations as effectively and efficiently as possible, it doesn't make sense to have a standalone quarantine facility where we have a smaller number of locations per city. So in Christchurch and Wellington, we have arranged an assessment of each facility to see if they determine the criteria for both quarantine and isolation, and so that's what we do, and we have them in both Wellington and Christchurch.
Just further to that, there's an important safety element to this, that we do not want to be organising air bridges for known COVID positive patients, that it's much safer to put them into quarantine in the area where they already are. But just in terms of your first question, just to clarify, the person that transferred down, as all the passengers off that flight from LA wouldn't have come on a commercial Air New Zealand flight. They were charter flights that are air bridges between the arriving international flights and the managed isolation facilities. So there is no mingling with the general public.
Just on the air bridges, the press has a copy of a letter that was sent to you in June, apparently showing that more than 100 people who were in a managed isolation facility and were transferred to Christchurch, that occurred without information on whether they had been tested being present, and that health officials thought this was possibly dangerous, and that it happened in the middle of these returnees' isolation. Is that correct? And what was your response to that?
I'd have to go look. I'd have to go back and look at that particular piece of correspondence. I think I know the piece of correspondence you're referring to, but we'll get back to you. I'll have a look at it.
With that at the time?
As I said, I'll have to have a look at the piece of correspondence. You're asking about a very specific thing. We'll come back to you.
I think I can recall.
Yeah, I can. I think.
Okay.
Yeah.
If you can recall.
Yeah.
Any more information you'd like to share?
Yeah, I was just going to say, we obviously looked hard at that scenario and determined the best location to test somebody was at their final destination. That was following health guidance. So those people would fly, and it's the same system we use now. So they fly in to Auckland, they are facilitated under a level 4 environment onto a transfer charter aircraft down to their isolation location and are tested from that point on.
That correspondence is more just someone raised issue with this protocol, but you determined that was still the best protocol.
From memory, and I will come back to you with the specifics, that this was actually at a point of time when we initially took responsibility and accountability for running these facilities, where we were running into some capacity issues, and there were people from various timeframes and various cohorts that were transferred to managed capacity. That is not something that happens anymore. In terms of our ability to manage the flows ins and out, and to make sure that we're, by and large, trying to keep cohorts together when we provide air bridges. So that's an example of one of the things that has evolved over the 8 or 9 weeks since we took on this role.
Another matter, can I just clarify, when someone is in quarantine because they've been tested positive at either day 3 or 12, do they have to again be tested in order to successfully leave quarantine? Or if the term of period's up, can they just answer the health questionnaire and then leave?
So this is a health process from there on in when someone is in quarantine. So when someone has tested positive for COVID, there are then a range of, as with anyone, as if it were a community case, a range of indicators that health use to determine that nobody is still infectious. One of the things we do know about this virus, that it is possible to return a week positive quite some time after you've recovered and you are no longer infectious. So a negative test isn't the right tool to determine when it is that someone can be released. That's very much around symptoms and what we know about the virus and what the epidemiology tells us around when it is safe to release people. And that is a process that when someone goes into quarantine, that health then runs.
Wellington case returned a negative day 3.
I'm not sure if that was a negative day 3 or day 12. We'll have to get back to you on that.
So his day 12 is positive, but had he already done a day
We'll have
with
to
negative?
double check and let you know about that. Well, I mean, they would have, if they were still not in quarantine, if they were still in isolation, my assumption would be that they had returned a negative day 3. And we have had a couple of instances. This is why we have 14 days managed isolation, because that's what the epidemiology tells us, that sometimes that's the kind of time period that you need to take, particularly if someone were, for example, to contract the virus at an airport before they got on a plane. There's a variety of scenarios. But we'll come back to you whether or not they had completed their day 3 test.
Why not make day 3 tests mandatory? I mean, you know, you have that public health response order where they have to test negative before leaving, and you have that low risk profile. Given day 3 is an extra layer of protection, why not make that mandatory?
So it's a really interesting question. I think what we're seeing is that we are having very high levels of day 3 testing. We can demonstrate that 95% of people have been undertaking day 3 tests. There'll be some reasons why a large number of those aren't, and I went through quite a list of those. So the actual low numbers that aren't doing it, but we're still working through exactly what that might be. But I think one of the things to remember is that yes, day 3 testing is a tool, and it is an important internal tool for how we manage our managed isolation and quarantine facilities. But the most important tool that we have in our kit in running these facilities is to treat all returnees like they could have COVID. So
but
that
day
is the
3
most
could be an
important.
extra layer of protection,
Yeah.
so why not make that?
Yeah, look, and I mean, look, we, as we've shown, we're willing to evolve and we're willing to look at change. And if that is something that is deemed necessary, then that is certainly something that we will pick up with our colleagues in health. But I think one of the things that the public have to have some certainty about is that we have not seen either a community case of COVID linked to a managed isolation facility, but importantly, we have not seen community transmission within our managed isolation and quarantine facilities either. We have not had an outbreak. The day 3 test would become even more important if we were seeing that. I think what we're seeing is the success of the system that we are running.
The source of the infection in terms of the Auckland cluster, that's still a mystery, so you can't say with a strong degree of confidence that there is no link to managed isolation.
What I can say is there is yet to be a link established, and I can say that with absolute confidence because there has not been, we have not had a link that shows any link that is any conclusive link to a managed isolation facility for the Auckland cluster, and actually the genomics would point us in the direction that it is highly unlikely, because that is something that we've been chasing down really hard in terms of not only the strain but also the generations of the strain.
The occupancy level.
In
terms of the occupancy level, the latest data we have is that there's 5,018 rooms that are full. There's 2,348 that are empty. There's another 600 being cleaned right now. So about 1/3 of the MIQ system is currently empty. There's no one in those rooms. Why are they empty, and are you doing something to fill them?
It's important that we maintain sufficient capacity at any given time. So 10% remains a contingency surge requirement. What we have experienced so far is actually continuing reasonable levels of volatility in international travel. The last thing we'd want to have is a situation where we had arriving aircraft which were full beyond what the plan was, and then have an inability to manage it. So what we've learned over the last probably 8 to 10 weeks is a need just to be quite cautious and be conservative in our approach to those numbers. We take a look at those all the time, and I tend to agree to say that we need to continue to identify mechanisms to lift those. We are engaging every single day with a range of airlines to work their alignment between supply and demand, and we are, you'll see as the data shows, actually those numbers are climbing in the next period. It's a 14-day cycle of activity, of course, so you can't just suddenly flick a switch and expect it to climb overnight.
In 14 days, though, you're only looking at 5,300, so that's only like another 200 or so rooms. It'd still be around a 30% empty. So are the airlines not selling enough tickets, or is it because of the quarantine here? Or do you have any understanding why people aren't coming?
Yeah, I think there's a range of measures. What we are seeing, certainly flights into Australia, they've put a number of conditions and constraints on the international air travel and domestic air travel in Australia. We know Australia makes up the vast majority of the arrivals to New Zealand, something like 80%. So when we're seeing higher volatility, less certainty of travel in Australia, consequently, we're seeing less movement to New Zealand.
Further to that, so you were looking to implement a golden ticket type system. Where is the hold up with that, and especially with Air New Zealand as well?
So there is no hold up. That work is progressing well. That's the managed isolation allocation system, and we're well on the way to having that being rolled out. We're expecting that in the coming weeks. We need to make sure that it's a robust system, so that we know that when someone is booking both a place in a managed isolation system, that they've also got the opportunity to match that with being able to get an air ticket, and that they can complete the two things in parallel. Because one of the things that we do need to know is when those people are coming. But I don't know if you want to add any more to that.
No, that's fine.
3 weeks, I think it's been roughly 3 weeks since the government started charging returnees for managed isolation. Do you have an update on how many people have actually been charged?
We can get that to you. I know that data does exist, how many invoices that we have, but I think it's worth noting on that we have also been running the exemption system around that as well, which is separate from the exemptions that Darren was talking about earlier, for people who find themselves in a position where they are unable to pay. But we can get you an update on that.
How long before you consider building standalone or specifically designed quarantine facilities to expand the size of quarantine, which seems to limit the number of people who can come in and out of New Zealand?
So I think they're two separate questions that you just asked me there, whether it's about building purpose-built facilities. That is, of course, something that we have, that has been in our thinking from the beginning. That part of our task is not only to manage the immediate and what we're going through now, but to think about what this might look like in a more semi-permanent state if we are needing to do this for another year or another 18 months. So we are not opposed to looking at purpose-built facilities. What we need to do is have a look at how that stacks up in terms of the cost of construction and the cost of running it compared to what we're doing, which is essentially leasing hotels at the moment because we've got 100% occupancy. But the constraint on managed isolation is not facilities. So to talk about doing that is a pathway to expand capacity, I think, is the wrong way of thinking about it. The constraint around managed isolation facilities is really around our health capacity and our ability to do this safely. So it takes an enormous amount of health resource to go into each and every one of these managed isolation facilities. And every member of our health workforce that we put into these facilities, we're taking, of course, from somewhere else in our health system. So we need to think really carefully about what the right balance is in terms of the ability of New Zealanders to return home, how we might want to open our border in the future, also with the need to have a functioning health system in New Zealand.
So where are we at in the process of deciding, yes, we need